and hosting us in this event today. And also a special thank you to NC Bio, Sam Taylor, Jean Haggerty, and Laura, and for all of the organizations that are here and all of the attendants. What a great group here today to talk about this very important issue, especially for the agencies that are here today through administration, because as we know, this is a very important time with elections on the forefront, and a very important time for all of us, and a lot going on these days. I'd just like to open with a few comments. Again, thank everyone for being here. Very, very important. I'd also like to thank Dr. Burgess, Congressman Burgess from Texas, who is the Vice Chair of our Health Subcommittee on Energy and Commerce. I'd also like to put out a special thank you to Chairman Pitts for being our chairman of the subcommittee, and for Chairman Upton, who they have worked so well together on the 21st Century Cures Initiative, and they have truly led the way in understanding of the importance. As members of the Energy and Commerce Committee, we feel privileged to be doing such important work, and this is a very special, important issue for me personally, because many of the treatments and cures that are being developed and will be developed will come from companies that are located here in North Carolina. The purpose of the 21st Century Cures Initiative is to examine the life cycle of drug development, the discovery, development, and delivery, and formulate policies that will speed up getting cures to patients. This is an almost unprecedented effort that will not only make a tremendous difference for patients, but again, for our state here in North Carolina. I am so proud that my state is such a leader in the innovation in biopharmaceutical industry. In addition to making life-saving treatments and cures, these companies in my state provide quality patient care and jobs. There are over 20,000 biopharmaceutical jobs in North Carolina, and over 9,000 of those are right here in the Raleigh-Durham area. Within the Cures Initiative, one of the areas that I am particularly interested in is the vaccines and how they are instrumental in ensuring health for all Americans. Vaccines are an important part of the solution to protecting public health. Over the years, they have prevented countless cases of disease and saved millions of lives. Diseases that used to be common, such as polio, measles, tetanus, just to name a few, can now be prevented with vaccines. The CDC estimates that the vaccination of children between 1994 and 2013 will prevent 322 million diseases, help avoid 732,000 deaths, and save nearly $1.4 trillion in total societal costs, which include $295 billion in direct health care costs. And this is just data from the pediatric population, where we have the highest immunization rate as a nation. There are additional cost savings in the prevention of vaccine-preventable diseases in adolescents and adults, especially the vulnerable Medicare population. Every day, innovative biopharmaceutical companies are discovering more diseases and conditions than can be cured or prevented with vaccines. Unfortunately, the cost and complexity of developing new vaccines has increased dramatically over the last 10 to 15 years. Clinical trials are bigger. The demand for more safety data keeps increasing. There are numerous reimbursement and delivery challenges, and it is expensive and time-consuming to build new manufacturing facilities for those complex biologics. For example, the beautiful new Novartis plant in Holly Springs took years to build and was a $1 billion investment. Even though we currently have a suite of excellence, safe and effective vaccines in the United States, there is still more that can be done. Both large and small vaccine companies are working on new and exciting vaccines in many areas where there is significant unmet medical needs, such as in making improvements on existing vaccines, creating vaccines that will protect against healthcare-acquired infections that come from antibiotic-resistant bacteria, and important global infection diseases like TB, malaria, and HIV. Vaccine development is also personal to me in that many of these important treatments are being developed, again, right here in my district. I'm happy to have 5 companies that are here today, and I'd like to welcome them as well, which will be located specifically in my district. Pfizer, Novartis, and the other 3 have employees that live in my district, GSK, Merck, and Arborvax. I'm also thankful to the many government witnesses that traveled here today. Many vaccines have different purchasing situations than pharmaceutical drugs, and the government is often the primary purchaser. It is unfortunate that CMS is unable to be with us today at this roundtable, as they are one of the largest vaccine purchasers in the United States, as well as the important government partner when it comes to delivering immunizations to protect the U.S. public health. I look forward to working with them on the 21st Century Cures Initiative and policies to support childhood and adult vaccination. Additionally, we have Duke University and Every Child by 2 that have come here today to participate in the roundtable. I look forward to hearing from all of you, and I think we'll have a great discussion today. To begin, let's go around the table and have each of the participants do a brief introduction, starting with my good friend and Vice Chairman of the Health Subcommittee, Dr. Burgess.
Well, thank you, Renee, and I want to thank you for letting me be part of this roundtable today. We'll thank the Ellmers Institute for hosting. I will have to say I've done a number of these field hearings with the committee around the country. This is one of the most impressive panels that I've seen seated, and it is a very packed audience, so just indicative of the interest there is in this process. For people who are unfamiliar with how things work in Washington, let me just say that what you see before you is unusual. It is literally the lion lying down with the lamb. You have members of Congress, you have representatives from federal agencies, you have the private sector, other roundtables, we've had people from the investment community. And the important thing is, rather than retiring to a windowless room in the basement of the Capitol and figuring out what will be good for you all, the Cures Initiative is taking this show on the road and hearing from people around the country. We do listen to the people at the agencies, to be sure. We listen to the people who were at the laboratory bench day in and day out, coming up with, trying to put their ideas into practice. And we listen to people who are on the investment side, who may discover or may relate to us how something that they have discovered has then been impacted by a decision we either made legislatively or one that was made through rulemaking at the agency. So it's all important as to how it interrelates. The 21st century, we all remember, or I remember growing up, 21st century, we thought we'd have a flying car. Well, that'd be neat. If we did have a flying car, we'd have to have a federal agency to regulate how the flying cars flew. But where's the cure for cancer? Why haven't we figured out MS? Why do children still suffer with cystic fibrosis? And that's what the Cures Initiative is all about, and that's the work it has set itself out to do. So I'm grateful to other members on the committee. I'm grateful to the agencies for being here. I want to thank the committee staff for traveling and being here as part of it. It's been a privilege for me to attend a number of these around the country. It's not unusual for them to be bipartisan. The fact that you have 2 Republican members sitting here today is in fact an anomaly. There are frequently Democratic members at the roundtable as well. This is truly a bipartisan effort. Maybe with a little luck we can make it a bicameral effort as well. Thank you, Renee, for letting me be here.
Well, thank you again, Dr. Burgess. And I do want to say on that note, we did put out an invitation to Congressman G.K. Butterfield, who also sits on the Energy and Commerce Committee with us, but he did have a conflict and was unable to make it. We did, again, try to make it as bipartisan and bicameral as we possibly could. At this time, I would like to introduce Dr. Karen Midthun for a few words. Thank you.
Sure. Thank you so much. I'm the director of the Center for Biologics, Evaluation Research, and it's a real pleasure to be here today. Thank you so much to Representative Ellmers and also to Representative Burgess for inviting me and the others. Commissioner Hamburg and other senior FDA colleagues have been at a number of these 21st century cures and hearings at roundtables, and we are fully committed to what the goal here is. It's really to try to move products from bench to patients more rapidly, but ending up with safe and effective products. And let me just say a few words about vaccines. Vaccines are near and dear to my heart. I'm a physician, an infectious disease specialist, and I was actually the director of the Office of Vaccines before I became the director of Center for Biologics. You know, vaccines are unique in many ways. As Representative Ellmers said, you know, they really have been a tremendous force in preventing infectious diseases and really saving millions of lives and also a lot of serious disease. But they are different in the sense that they not only impact individual health, but also public health. They're very important in that regard. The other thing that really distinguishes them also is that vaccines are typically given to millions, in the case of influenza vaccine, hundreds, over 100 million individuals every year. And so there really is a very high expectation for safety and effectiveness. So the risk-benefit for a vaccine will be different than one for a patient being treated for cancer. It's a different calculus. But nonetheless, vaccines are critical. It's really important to develop them rapidly and efficiently, get all the information that you need that really supports the safety and effectiveness. And to that end, I just want to mention that the expedited pathways that FDA has, for example, breakthrough designation, accelerated approval, priority review, fast track, apply to vaccines just the same way they apply to other drugs. And we use all of these. We've used accelerated approval in many areas in influenza vaccine, pneumococcal conjugate vaccine, to name a few, and also breakthrough designation also applies to vaccines as well. So again, it's a real privilege to be here. I really appreciate the opportunity, and again, thank you so much to our hosts.
Thank you, Dr. Midthun. And now I'd like to introduce Dr. Robin Robinson with the Biomedical Advanced Research and Development Authority.
Good afternoon, Congressman Ellmers, Vice Chairman Burgess, and other distinguished guests and HHS colleagues. Thank you for the opportunity to be here with you to talk about vaccine programs for both man-made and natural public health emergencies, including the present Ebola epidemic. We at BARDA, the Biomedical Advanced Research and Development Authority, and HHS are responsible for supporting advanced development, and that's key right there, advanced development, because Dr. Holland will tell you we take a baton from them from early development going forward, and that FDA and our colleagues at CDC actually are there with us as we make that transition all the way to licensure of vaccine products. I, like Dr. Midthun and Dr. Holman, have been working on vaccines for most of my career, before I came to government and industry, to developing new vaccines, to moving forward with vaccines now for smallpox, for anthrax, for influenza, and now for Ebola, working hand in hand with my partners here. We also have provided infrastructure to help developers on an everyday basis to develop and manufacture these vaccines through many different core service programs. I owe Carol Hammond and NID with that concept, because they have been helping a number of companies for many, many years in academic institutions, but we actually have Animal Services Network, a Centers for Innovation and Advanced Development and Manufacturing, one of which is here in North Carolina, another which is in Texas, and our Field Finish Manufacturing Network, and a Clinical Studies Network that's just getting off the ground now. But in addition, we work with industry as partners, not as clients, and not as customers, and not as adversaries. We work with you as partners with skin in the game from both sides, with funding from you and from us, and certainly the facility here in North Carolina is an example of that co-ownership and co-partnership that we have been able to do. Bringing all these efforts together, we hopefully will be able to manifest vaccines that are safe and shown to be efficacious in the Ebola epidemic. And we appreciate the opportunity to be here. Thank you.
Thank you so much. And